Mr. Middleground, not too much, not too little. A balanced formula for steady hair growth with a low dose of finasteride. We set out to create a formula that doesn't lower DHT, still provides the benefits of the most used DHT blocker, finasteride, and maximizes growth stimulation from other hair loss pathways. Mr. Middleground uses a topical dose of 0.005% finasteride. Mozzarella et al. Assessed the effects of 0.005% topical finasteride applied twice daily in a single-blind, placebo-controlled trial. The study included 52 participants, 28 males, 24 females, over 16 months. Mozzarella found that there was no measurable change in serum DHT in any of the participants. Accordingly, there were no reports of adverse side effects, which is the biggest risk anyone takes when using finasteride. Without systemic DHT, can we still regrow hair? In the same study, Mozzarella found that patients began to notice a progressive decrease in the rate of hair loss. By the 16th month mark, 12 patients in the 0.005% group noticed a significant reduction in balding areas, while the remaining 14 noticed a slight reduction of balding areas. The treated patients also noticed an increase in density and hair growth in the previously bare parts of the scalp. Based on Mozzarella's study, our group of scientists believes that 0.005% is the lowest finasteride dose that can both A, not affect systemic DHT, and B, still provide significant hair regrowth, albeit over a longer time period than higher doses of finasteride. Other than finasteride, Mr. Middleground uses 5% minoxidil, 6.5 nanograms per milliliters of T3, and 0.5% Levocetirizine. All three of these ingredients have shown promising regrowth results with minimal systemic adverse effects. Mr. Middleground uses a topical dose of 5% minoxidil. Olson et al. Measured the effects of 5% and 2% minoxidil in a study of 393 men. Olson found that minoxidil 5% regrew about 15 hairs per square centimeter more than the placebo group, with resultant changes in scalp coverage and patient happiness. Notably, of the 139 men in the 5% minoxidil group, 0 serious adverse events were reported, with 7 non-serious adverse events. 5% minoxidil has the strongest safety data of any topical hair loss treatment. With its regrowth profile, our scientists believe it is an attractive option in almost all hair loss solutions. Mr. Middleground uses a topical dose of 0.5% Levocetirizine. Nizrolihi et al. Studied a group of 20 men on 1% Cetirizine compared to 20 men on 5% minoxidil. Nizrolihi found that 1% Cetirizine improved both hair density and the Anagen to telogen ratio of hair follicles at a lesser rate than minoxidil, but still at a noticeably improved rate to patients' baseline. While there was no control group in the study, Cetirizine's mechanisms of actions, blocking PGD2 while promoting prostaglandins E2 and F2 alpha, are known desired effects in hair growth treatments. Its antihistamine effects will also counter local inflammation at the hair follicle, which our scientists also believe likely contributes to hair loss. The data from Nizrolihi and other studies, Cetirizine's mechanisms of action, and the reports of 0 adverse effects of Cetirizine are why it's included in Mr. Middleground. However, you'll notice that instead of 1% Cetirizine, we use 0.5% Levocetirizine. Levocetirizine is a second-generation design of Cetirizine, designed to limit the most known side effects from Cetirizine, namely drowsiness. Levocetirizine is more potent, but does not cross the blood-brain barrier to nearly the same extent of Cetirizine, consequently does not induce drowsiness like Cetirizine is known to do. Mr. Middleground uses a 6.5 nanogram per milliliter dose of T3. Around 500,000 people use it every year at 5 to 50 micrograms per day for hypothyroidism. Our scientists discovered that T3 may provide significant benefits at around 1,000 times lower the dose. In an observational study of 6 people under the supervision of Dr. Richard Powell, it was found that participants experienced an average increase of hair regrowth of 42.5 hairs per centimeter. None of the participants reported any side effects during the observational period. For those who underwent blood tests before and during treatment, there were no meaningful changes in serum T3 or T4 levels. While these results may be surprising, preclinical tests conducted at the University of Miami on human scalp skin organ cultures and human hair follicles showed similarly promising results. Both T3 and T4 were found to prolong both hair length and growth phase of the hair follicle, with several other key biomarkers observed. To summarize, Mr. Middleground is designed to not affect DHT, still provide the benefits of the most used DHT blocker finasteride, and maximize hair growth stimulation from other drugs. Hopefully you find strong regrowth with no side effects while using the product. It's important to remember that every patient is different. You can be an outlier in either direction, and you should always consult a doctor about any questions you have before, during, or after your treatment. If you've ordered the product, be sure to let the world know how it works for you.